Welcome to Gene Clips. My name is Anna, and I'm a genetic counselor at Children's National Hospital. Today, I will be talking about sickle cell disease. As you may know, the genes in our DNA provide the instructions that make us who we are. They determine which traits we inherit from our parents, but they also tell our bodies how to develop and work properly. Humans have over 20,000 genes in every single cell of our body. We have 2 copies of most genes, one we inherited from our mom and one we inherited from our dad. Sometimes changes can happen in our genes and can cause our body's instructions to not work correctly. Changes in a gene called HBB can cause sickle cell disease. Specifically, a person has to have a change on each copy of the HBB gene to have sickle cell disease. Sickle cell disease is also sometimes called sickle cell anemia. In sickle cell disease, red blood cells may change shape and form a crescent or sickle appearance. The cells become stiff and sticky, causing them to block blood flow, preventing oxygen from getting to vital organs. This can cause many symptoms like low red blood cells or anemia, pain, and feeling tired and or weak. Generally, symptoms onset in early childhood, and signs can include swollen and painful hands and or feet, crying, and severe infection. Sickle cell disease can occur when both of a person's parents are either affected with the condition or are carriers for the condition. Being a carrier means that a person has a change on only one copy of the HBB gene and is often referred to as having sickle cell trait. If both parents have sickle cell trait, the likelihood of having a child with sickle cell trait is 50%, the likelihood of having a child with sickle cell disease is 25%, and the likelihood of having a child with neither sickle cell trait or sickle cell disease is 25%. The risk is the same for each pregnancy between 2 carrier parents. If someone has sickle cell trait, they are often unaffected themselves. In some cases, they may become symptomatic, especially under certain situations or activities like mountain climbing, dehydration, or while scuba diving. Sickle cell trait and disease are more common in some populations, like those with African or Hispanic descent. However, it can be found in people of any ethnicity. Treatment for sickle cell disease can include intravenous fluids, medications, and blood transfusions. There are also emerging technologies such as bone marrow transplants and gene therapies. For this reason, it's important to follow up with a specialized care team that includes a hematologist. Your geneticist or hematologist can order testing and answer any questions you have about sickle cell disease. Thank you for watching Gene Clips.